I'm Dr. Craig Bax. I'm the Chief Medical Officer and founder of the Cure Center for Chronic Disease in Springfield, Illinois. And I'm also the CEO and founder of the Cure Coach Incorporated. I've been practicing medicine for nearly 40 years now, and I've been exclusively in the primary care realm of internal medicine. About 10 years ago, I entered a more preventive and chronic disease reversal program that I now call the Cure Center. The Cure Center was founded after I learned that there's much more that we can do for the reversal and ultimately remission and cure for chronic diseases of atherosclerosis, which is hardening of the arteries, the cause of heart attack and stroke, the most common cause of death and disability in our society. For the last 9 years that I've been doing this, I haven't had a single patient suffer a heart attack or a stroke or require a bypass operation or a peripheral bypass surgery. Given the track record that I just don't see these conditions, these events that are disabling, life-threatening, life-altering, I feel pretty comfortable now saying that we are curing chronic disease. The first thing we offer is what's called a discovery call. Because we feel that it's important for the patient to know if this is a good fit for them. And we answer the questions about what does it cost, what's involved, do I have to come to the office here physically? We offer telehealth consultations for many of our patients who live some distance away. And then once they decide that this is right for them, then they register on what's called the Cure Coach platform or app or portal, if you want to call it that. This enables us to efficiently gather their history and information about themselves, about their lifestyle choices, and start to determine what it is that they need. We also start with a general battery of tests, that some of which are familiar to patients they've had before, like their lipid panel and glucose and hemoglobin A1C, but we expand that and include inflammatory markers, vitamin D, and other more specific deep dives into things that are traditionally followed by their mainstream healthcare providers. We like, whenever possible, to get an ultrasound of the carotid arteries to measure their arterial age for a baseline, but it's not necessary in every case to get started. And then ultimately, when we have that information from the patient, from their laboratory, from their ultrasound, or other imaging sources, if that becomes applicable, then we arrange what I call a Cure Coaching session, so that we can figure out how to develop their personalized plan to reverse and ultimately cure their arterial disease, diabetes, or any other related conditions that appear in the process. So once we establish that plan, typically every 3 to 6 months, we see the patient back either in person or via telemedicine and make sure that the plan is staying on track. It's really a game plan for improving one's health by reversing arterial disease and diabetes if it's found, so that people can avoid the consequences, be it a heart attack, stroke, disability, dementia, chronic kidney disease. My goal when I'm done, and I don't really think about retirement, I want to keep going, is that I don't hear from anybody the tragedy of losing a loved one suddenly to a heart attack that came out of nowhere, or needing to put their loved one in a nursing home because they had a stroke and they could no longer take care of them. So it's, in essence, just to eliminate the consequences of arterial disease and diabetes from the challenges that people face as we grow older. I think for anybody considering this, the least selfish thing you can do for your family and your loved ones is to keep yourself healthy. And we offer that opportunity. We don't expect perfection. We just try to help everybody do the best they can. And our success rate is better than I could have even imagined when I started doing this.